So now what we're going to do is look at some of the interventions that do exist for MSM and gay men. And we're going to give you quick overviews and then some highlights from some programs that are doing the work. So our first one up is an intervention called Many Men, Many Voices. For short, we call it 3MV. It's a group-level intervention specifically for gay men of color. So what it is it's a 7-session group-level intervention, so people meet in groups. It targets the individuals to change their own behavior, and it's facilitated actually by a peer in small groups of 6 to 12 individuals. The main target population is Black MSM who may or may not identify as gay. Sessions are highly experiential, meaning there are a lot of group activities, a lot of times for them to do practice, skills practice, group discussions, and role plays for all of us who love those role plays. And there is theory and evidence behind this. It's adapted from a behavioral self-management and assertion skills intervention that is actually now called Partners in Prevention. The original research findings were that it significantly reduced the frequency of anal intercourse specifically. That's what was measured among participants. So they reported much less anal intercourse after having gone through 3MV, and it significantly increased condom use among the participants. All right. So now to share with you their experience implementing Many Men, Many Voices, I'd like to please welcome Nadia Cabana and Juan Pablo Grul from Project Hope in Massachusetts. Skip that.
Good afternoon, everyone. Buenas tardes. Okay, we're a little nervous because it's the first time that we're going to talk to a big group out of our state. But we were glad that we're here. We're glad that we're here with you to share our experience. Okay, so I'm Nadia, director of the Amigo Amigo program.
And my name is Juan Grul, outreach health educator.
Okay, and our program is called the Amigo Amigo. That means a friend to friend. And we were funded by the Massachusetts Department of Public Health. Let's see. Okay. Where we work in Project Hope, and it's a nonprofit agency that has been in the Lynn, Massachusetts for 40 years, and it's been it's been doing HIV prevention for the last 15 years. And this program is Many Men, Many Voices. Has been there since 2002. We've been there 4 years doing what we're doing. Okay. What we do community outreach, risk assessments, supported referrals to HIV, STDs, and hepatitis screenings. When I say supported referrals, we actually bring the clients to the clinics to have what they want to have done. And we do that because most of them are a little afraid to go, maybe because the language barrier or a cultural barrier. So because they already engage with us in our program, they trust us more than the new people that they're going to be meeting. So that's why we do. I actually just go with them and sit over there with also Juan and the other outreach worker. We don't mind. We don't mind the time. We take them at different times. So because for us, the most important thing is for them when they're ready, because sometimes they can decide that at 7 o'clock at night. You know what I mean? So when they're ready, we'll do it for them. We work, even though we work 40 hours, we get paid for 40 hours, but we do this 24/7. So I'm glad to do it. I've been doing this for 15 years, so, okay. We work in the North Shore area of Massachusetts. Our office is in the Lynn area, but we go to different cities to do the outreach. And our target population is the MSM Latinos. Okay, you're going to talk a little more about the population, but I also want to say that every day we have newcomers from different Spanish countries. So they're new to the information because they don't have any information back in their countries. And when we want to engage them in this, they don't know what we're talking about. Sometimes we do groups and we mention what is HIV and nobody answers. And if they answer, they give you the wrong answer. So I think this is an education that cannot stop. So even though we're supposed to do the curriculum to MSM, we also do workshops in different locations. We just call the place and say, can we go to do a workshop? Because that way we let them know what we do so they can come to us when they're ready. Okay. Program strategies. Choosing the right team to be able to accomplish what we need to accomplish. We need to hire the right staff to work in this program. And we look for people who really like the work that they do and love what they do and enjoy what they do. And also they're very friendly, but they also keep the boundaries with the clients or the participants of the program. And also the team, as a team, that we all share everything that's going on in the program. So let's say Juan is sick and he cannot go to the bar tonight, and Carlos is in vacation. Somebody needs to go out there to do the outreach. Then I'll go. So that's how our team works. We never stop doing outreach. Supervision meetings. We do weekly supervision meetings where we talk about our challenges in the program and how to overcome the challenges. And we also talk about the success of the program. Communication. Communication is very important. Communication with the Department of Public Health, our managers in our agency, the staff in our agency, our team communication, communication with other agencies in the area, and the most important one, the communication with the clients. We need them to trust what we do, because sometimes because we speak the same language, or they may say, well, I don't trust them because I already know Juan, I already know Carlos, so I don't want to go there. So they come to me, and then I'm like the person who engaged them to go to the guys or to come to the groups. Networking. We like networking. What we do is we call different agencies and we tell them we want to go and visit them and we want to present our program in their staff meeting. So we usually do that and we introduce ourselves, and we also want to know who they are, their names. So when we refer people to them, because we not only refer people to HIV and STIs or hepatitis C screening, people also come with other issues, domestic violence, immigration issues. So we want to know who are we sending these people to. We want to see faces and we want to know names of providers. So I can call them and say, I'm sending a client to you. I want to make sure that he goes over there when it's domestic violence or immigration related. So sometimes we invite it to go and do workshops to their staff also. Trainings. It's very important that the staff is well trained. So we go to trainings that is mandatory by DPH, but we also request to go to all the trainings related to what we do. And we have the freedom to go because we have the support of our agency.
Okay, why did we choose this intervention? Back on the early 2000, there was not many EVI or DEBI to choose from. This intervention is called 3MB, like you guys heard. It was chosen to target Black and Latino Hispanic MSM from the North Shore area that are at high risk for HIV and STD. By that time, 3MB was only the one available for those populations, especially specific for Black MSM. Still, we don't have anything available for Latino, MSM Latino specifically. How do we recruit people for this intervention? Through the bar outreach. The bar outreach is the most successful place to find MSM, gay men, bisexual. And it's very important how you're going to approach the people without giving the wrong idea, because they might think that you're approaching the person because you want to engage with them sexually. So you got to make sure and be careful how you're going to approach the people, especially the young crowd. Cruising area or public sex environment. This is a great place to recruit bisexual men, because usually they don't go to the bar because everybody knows everyone in the community. They don't want their wife to know that they're going to those places without her. Street outreach. For this intervention particularly, the street outreach hasn't been as good as the cruising and bar area, but the street outreach has been very successful for substance abuse program and substance abuse prevention and day programs. Recruitment events. The recruitment events, we have 3 series every year, 3MB. And before we start any series, we have a recruitment events. We can have a cookout, we can have a nice dinner. If it's winter, it depends on the weather. And what we do, we promote the activity at the club that we go. We invite people, we invite like the former participants. So, and that's how we gather people for the intervention. Media campaign. We have 4 TV shows every year. When we promote different stuff, we talk about the program, we talk about the agency, and this is a way to broadcast the program and bring people to the program.
Let me say something about the recruitment.
Okay.
Recruitment events are very important because when we do them, we bring a list of people to sign, and we give out raffles, small gifts. We put a big table, and then we agree with the manager of the bar. Then we put our cards everywhere. We bring food, and we usually have like 300 people that night, and we bring counseling and testing the same night.
What were our challenges and how we overcame. Language can be a barrier, especially when we have Latinos, people that were born here, so that Spanish is not very fluent as mine. The length of the 3MB program, it's like 7 weeks. It's really hard to keep and retain the clientele. What we have done, we do it in 4 weeks. We combine section 2 and 3, and 4 and 5 in 1 day each. Retention or participation. In order for us to keep the clientele coming to the program, we have to do like, we offer Walmart gift cards, we offer like movie passes and different type incentive. We also, it's a little hard to have people getting tests for HIV and STD. What we do, we invite agency to our program, to our groups, so they offer the counseling and testing. We don't allow rapid tests just in case somebody comes out positive. In case somebody comes out positive, the person who is testing will contact the client before give everybody the result. Cultural competence. Even though we work with Latino, there is a lot of Latino from the Caribbean, from South America, Central America, that they have different concepts, depends on what we're talking about. So we create different ground rules for the specific challenge, respect everybody's opinions and beliefs. Our success, we have monthly workshop beside the 3M intervention. So we do monthly workshop. We have like 10 different topics. 4 of them, we offer counseling and testing. And this way we can keep the client connected in case they need another services beside prevention education. Individual level intervention, in case somebody doesn't feel comfortable talking about their sexual behavior, sexual practice, they always can come to us one-on-one. They usually go to Nadia, because she's always available. Availability for participants. What we do in order to have a better success in the groups, we do the groups on Sundays evening, which is not the best time for us, but it's a time that actually have worked for the program. Setting for the intervention. We don't do the intervention in the office. We go to people's home, participant houses. We make them feel like a family environment versus a class setting. That's it.